So one of the most common questions we get asked is, how is it that we help patients determine what size implant to use? And I think that there's a lot of different variables that go into this. In addition, each surgeon has their own technique on how they do this. I think the first thing is how I determine whether my technique is the right way to do it or not is really all based on what's my revision rate for dissatisfaction. So if I'm having a lot of patients that are coming back for size exchanges because I didn't get the right size, that would usually indicate that I need to change my process. So in my experience, actually, the number of times a year that I have to swap out an implant because the patient is dissatisfied with the size that we chose is, I wouldn't say it's zero, but it's maybe once every few years. So with that being said, in general terms, usually people are divided, or surgeons are divided into two camps. One is a sized or volume-based approach, and the other is based on just tissue dynamics or the size of the chest. So this is a patient that we just did where what I have the patients do, outside of taking measurements, I also really highlight or have them focus on what is the look that they're going for. And I have them pull before and after pictures. And this is just an example that this patient chose from our website. Obviously, she provided some other ones from other surgeons' websites that she liked, and I look for consistency in the before and after pictures that you're choosing. So at the exam portion of the procedure, I take some measurements to determine what's acceptable. Definitely, we often will take a number or measurement called the base width, and that number can help guide what would be considered a natural breast augmentation. But what I find is that a lot of patients don't necessarily want what I would consider a natural breast augmentation, as much like this is not what I would necessarily refer to as a natural result. So we take the base measurements, how wide the breast is, to kind of give us an idea or a target range, but at the same time, I more importantly focus on what it is that the patient's looking for. And if she chooses a size that I think is just totally outside the realm of what her body can handle, we'll have that conversation. But I find that most patients are have really pretty realistic results. So for example, in this patient, we look at the before picture, what they want, and from that, I usually will recommend a range of sizes, and that they'll trial some sizers to see if those correlate. And then with that being said, what we do at the time of surgery is we go into the operating room, we make the pocket or entry, and then we put sizer or sample implants in, and essentially just look at the before and after pictures to determine how closely they're aligned. So like for a patient like this, who has this before and has this after of what she wants, I'm gonna recommend for her that we're in the 400 cc range somewhere. And in the end, what I ended up doing is doing 415 and 450 on one side. So that's how we choose the breast implant size. It's really all based on desire of what the patient wants.